team. We're going to continue our talk. Are you able to hear me well?
Yes, doctor.
Okay, thank you. So we're going to continue our anxiety, and we'll take the next case. So the reason I do cases, because I think cases, we can discuss the subjects through cases, so it will stick in your mind much better. So we are continuing in the psychodynamic and psychotherapy explanation of general anxiety. So the second case will be Dr. Z. Dr. Z is a 46 years old who came to the clinic with severe anxiety. This is always when we talk about patients in their 45 to 50. This is the area of the age where most people have what we call midlife crisis. So this is a very critical area in the human being, especially in the male, where they go through very hard difficulty like another adolescent. So this is a red flag. When you see somebody in this age, you almost put a red flag about his anxiety. It might be related to a midlife crisis, what we call it. So he worked in very stressful and busy clinic. That's also add to the spectrum. And also he had marital difficulties. So he's married, but he is having a lot of problem with his wife. So this is the 3 red flag we need to look at into presentation of Dr. Z. So he presented with severe anxiety and agitation. He had poor sleep. He also has been fighting with his new secretary. So the issues start to clear up a little bit here, that he is very anxious. He's 45. He's very stressful in his life, and he has severe anxiety. Adding to that, he had this fight with his secretary. After analyzing the Dr. Z, we said when we talk about any anxious patient, we need to look at the unconscious triangle of conflict. So any patient who had anxiety, we need to look at the conflict, what's going on in the unconscious mind. Because the presentation is that he's anxious, but the root of anxiety might be deep in his unconscious mind. And after analyzing Dr. Z, we found out that Dr. Z really is trapped in his marriage. And when we see somebody trapped, those patients are very vulnerable for anxiety and panic attack. Let's see, if you are trapped in a marriage or in a job you don't like or in a place you don't like, then you are very, very subject to anxiety. And that's what happened to Dr. Z, where he's trapped in that very unhappy marriage with his wife. Adding the stress of work that really mount to cause him to be really panic and anxious, like what happened. But the problem is this anxiety and agitation worsened after he hired a new secretary. Apparently, the office where he worked, they hired a new secretary. The new secretary was very beautiful and attractive. So Dr. Z started fighting with her all the time and stated that he want to fire her. She's doing a crappy job and she's really ugly and not good. And so although all the odd is against that, because the lady was really good and she's very productive and she is very, very beautiful and attractive. So what happened after analyzing Dr. Z, after spending a lot of time knowing Dr. Z and 6-7 sessions of therapy, we found out that Dr. Z was in love with that secretary, due to the lack of enjoyment with his wife and all of this feeling he had and the stress. But the problem, if we look at the psychodynamic complication now here, is the superego is against that. So the id or the desire of Dr. Z to be with this lady is very severe. It's very tremendous. But the superego, you cannot marry her because this is America, this is in US, and he's already married, and you cannot have 2 wives, and all of that, complication there. And it's going to ruin his job if he do that. So it was severe struggle in his unconscious mind that caused him to have severe anxiety. So anxiety coming here is stemming from the desire to have relation with her and marrying her, and the superego prevention of that. So we said when the superego anxiety happen is related to the desire versus the ability to do what you want to do. So this the 2 problem he had. So the ego came here with the defense mechanism called reaction formation, where he present with the opposite feeling. So reaction formation is when you present with the opposite feeling of what's going on. So he is in reality, he is on the surface, he is hostile, and he's fighting with the secretary, and he don't want to fire her, and she's bad and not good, and all of that. But in reality, the superego is trying to protect Dr. Z. The ego is trying to protect Dr. Z because in reality, he's in love with her, deep in his unconscious mind. So, but he cannot marry her. Why? Because it's against the law, and it's very hard for him to do that. It's not going to be legal to do that, and there is a lot of obstacle. So the way ego here is going to come and help Dr. Z unconsciously by doing this defense mechanism, presenting with the idea that she is really bad and she should be fired and she is not good. All of this is to prevent Dr. Z from having all of this anxiety about the conflict between the desire and reality of what's going on. So here, panic and anxiety happen according to the psychodynamic therapy is when we have an impulse that we really have hard time, suppressing down, and it's coming to the surface. So when Dr. Z thought of her as a lover or as a wife, that idea, that impulse, which made him feel in love with her, was very threatening for him. So on one hand, he cannot push it down and keep it suppressed. On the other hand, he cannot let it go up and be on the surface because that will ruin his future. So that severe struggle is what caused the anxiety here. So the concept here is the root of the neurosis, the root of anxiety is this unacceptable impulse attempting to break through the conscious level, and it was very threatening. So on one hand, he cannot push it down, bury it down. On the other hand, it's coming to the surface and he cannot acknowledge it. So he cannot bury it and he cannot acknowledge it. So that's what caused the severe anxiety. The way Dr. Z dealt with that unconsciously by presenting the opposite feeling to prevent him from having this panic and anxiety attack. So this is what you call reaction formation, where you present with the opposite feeling of what's really going on in your life. And this is very common defense mechanism. How did we know that? How we reached this conclusion? We look at the Dr. Z during therapy, and then always when we have anxious patient in psychodynamic therapy, we need to understand where is the conflict coming from. If you don't understand the conflict root, then you will not be able to help him because giving him medication is not going to work. You need to deal with the root of the problem. The root of the problem is really that he is very unhappy with his wife. He had very stressful job, and he cannot leave his wife because of his social status, and he cannot marry this new lady because of his social status. So he ended up with having severe anxiety. So this is what we call the free-floating anxiety for Dr. Z, where he is in midlife crisis. And we said in midlife crisis, most people try to change in these 45 to 50 age, where you look at your life and you want to do a lot of changes. So a lot of people in this age either marry another one or change car, change house, change job, I bought 2 cars at that period of my life. So always you need to do something to change your life because you feel miserable. It's like you are going to another adolescent period again. Added to that, in his unconscious mind, he is going through a very, very bad relation with his wife, where they are fighting all the time, but he cannot leave her for some reason, financial reason, and both are unhappy in the relation. We call that marriage in the graveyard. So it's a very unhappy marriage. And the stress of his job, plus the unhappy marriage, plus the uncertainty about his future with his wife, and probably he is going to be approaching 50, and that's really a very critical period for him. Having this beautiful lady in the office caused him to awaken up all of this feeling he had before, and cause him severe anxiety because he couldn't do anything about it. So this is where we really need to talk about psychiatry. This is a chance to tell you that psychiatry is really not about the crazy people. It's not about dealing with crazy people. It's because a lot of patients are suffering and we are not reaching them. Only, 20% of the people who have psychiatric problem are getting treatment. There is 80% who are not seeing any treatment. We always need to understand that Dr. Z's behavior and our behavior is coming deep from the unconscious mind. Dr. Z presents with severe depression and anxiety symptom, but that severe anxiety and depressive symptom is coming deep from his limbic system, where his feeling is, and where he's very, very unhappy. But he was able to suppress those feelings for a long time and live with them. And having very, very miserable life. So on the surface, Dr. Z in the frontal lobe coming to us with severe depression and anxiety. But deep inside Dr. Z, there's a lot of resentment. There's a lot of feeling. There's a lot of, anger and emotion related to the wife and the life in general, and having very, very poor ability to handle these issues. So our treatment for Dr. Z really is what we call self-awareness. So we cannot go to Dr. Z and tell him you are in love with her and all of that. No, we have to approach it very, very carefully. So starting with talking about his wife and his marital problem and his happiness in life and how he learn how to deal with emotion and feeling all of his life, and then slowly get to the real problem where explaining to Dr. Z what's going on deep inside his unconscious mind in that ocean of reservoir of emotion, and why this anxiety and anger is coming to the surface is really because he is not fulfilled. So we call that he is not fulfilled in his marriage. And you see a lot of people in our clinic who are not fulfilled. When you see some patients who are angry easily, not sleeping, with chronic anxiety, a lot of agitation, those people, we call them unfulfilled. Unfulfilled, like he's married, but he is not happy. He is having money, but he is not doing well with his money. He is having a great job, but he's always fighting around him with people around him. So this unfulfillment is related to deep inside the unconscious mind. And we really need to dig deep to see where this unfulfillment coming from. Is it the wife? Is it the money? Is the career? Is the childhood trauma? So that's why, I suggest that in the Mysterian, the mysteries of, of anxious life and how we deal with anxiety by going deep in the root of the anxiety, but not look at the surface where we give the patient antidepressant. So we really, all of us need psychological help. I think psychiatrists or psychologists at some point in their life, because there's all of this reservoir of anxiety deep inside our unconscious mind that is manifesting in anxiety. Now, let's move to the next part of the anxiety is the cognitive model. So the cognitive model of anxiety is related to stress. So what we call CBT, cognitive behavioral therapy. So there is a situation like Dr. Z or Dinah where something happened, somebody said something, or we had a new secretary that caused him to be very scared because all of these thoughts come to his mind about his life and start all of the memory of all the childhood coming to the surface. And so we get panic and we behave in a very anxious way. And we filter information based on our schema. Our schema is what really killed us in here. Our schema is in the CBT, we talk about the schema. Schema is what is your perception about things. For example, when you say like Dubai, you look at Burj Khalifa and all of that. The schema is what is your perception or what is your previous thought about the situation. And most patients with anxiety, they have the wrong schema. So they look at life in a bad way. So they say, you listen to their word and they will say like life is difficult or I'm having stress in my life. So this means that there's unconscious mind is full of negative thoughts about life. Like Dr. Z, because he had very bad childhood, like Dinah, who had very bad childhood. So they are always scared because their schema is really bad about life. They have a lot of, we call it a lot of things that accumulate through life that cause them to look at life in a very bad way. And anything happen can really brought all of these bad things to the surface. So in psychotherapy, not only with medication, but in psychotherapy, we try to work on the schema and try to change the schema, which is very, very hard to do. That's why always, like when I see patient fighting with the wife, always tell them not to go to the unconscious level. Always try to solve the problem immediately, because once you leave things without part of you, and cause you to have a lot of problem later on. So always try to solve the problem, close this file quickly. If you have a fight with your wife about something, just resolve it immediately. Don't let it go to the unconscious level, because once it goes to the unconscious level, it becomes part of the schema, and it will affect you for the rest of your life. So being having resolved this conflict with her father long time ago, before it went to the very weak ego and affect the quality of her life for the rest of her life. So this is what you call the cognitive distortion in anxiety. For example, they are overgeneralization. So, for example, let's see, you dealt with a Chinese guy and he was bad. So your unconscious mind always makes overgeneralization. So all Chinese people are bad, because you have one example and you overgeneralize it. You're magnifying things. So if something happened and you blow it out of proportion, let's see, for example, you had failed in some one exam, and you immediately become feeling worthless. No, I'm a failure. You magnify things, which is just one exam you fail, but you passed hundreds of exams before. So we tend to look at the thing that we fail. We don't look at the thing that we succeed. So always we try in the therapy to change this, what we call it, the cognitive distortion, where we look at part of reality, because our amygdala, especially if we did not have good upbringing, if we have very anxious upbringing, we have learned from our childhood to only look at the negative things and maximize it so we can protect us. So we always personalize us. Like if you fail something and it's not out of your hand and you say, it's my fault, I'm a failure, you minimize your success. So if you succeed in something, you said, it's only easy and I should have made the bad as this. So it's always the process of thinking will be wrong. So that's what we call psychotherapy, or cognitive behavioral therapy, which is correcting the thinking we have and trying to make it normal, and not look at part of the truth, but look at the whole truth. Like if somebody said, well, I failed in one relation, okay, this is only one relation, or I had bad time with one Chinese guy, male. Well, not all Chinese guys are bad. So always challenge these behavior. And patient with GED, magnifying, making a mountain out of molehill, all of nothing thinking. So if I don't succeed in this, that means I'm a failure. No, you can be succeed in one thing and fail in another thing. But our brain tend to do this all or nothing, overgeneralization and minimizing our success. So this will be dealt with in psychotherapy. Give you another example. This is Tom. Tom is a cardiac surgeon in Michigan. He was one of our patients in Michigan. And Tom is one of the most well-known cardiac surgeons there at that time. He is 53 years old, and he is multimillionaire. You know, he made a lot of money, and he had a lot of money, and he's well-known, and, you know, he is very successful in his life. However, Tom used to come to the clinic with all of the money he had. He come to the clinic, said, Dr. G, and he used to see my friend, Dr. Talib. Dr. Talib, I feel I'm scared that I will be homeless at some point. I will not have anything to eat. So his anxiety is mounting that at some point he will be homeless and we will not have anything to eat. And theoretically, with the money he had, even if he didn't work any day, he will have enough money to survive for the next 200 years, he and his family. But for some reason, we said, go to the childhood. So always once things are not well, we go to the cognitive problem and his anxiety related to childhood. In childhood, Tom was, he had miserable childhood. His father was a gambler and lost all of his money. So Tom and his father, he was 3 years old at the time. He and his father was living in the street, and they were homeless, begging for money on the street in Detroit. Very, very poor guys. Then his aunt came and took him and, raised him, and he became a doctor, and then he became very, very rich. But still, the amygdala and the childhood event, the amygdala kept ruminating, kept bringing this picture for him, even though he is 53, he is very rich, he's very successful. He had the Mercedes and the Lexus and all of the 9 yards. He didn't have a dinosaur, but he had all the Mercedes. But he still feel like at some point, I'm going to be living in the streets. That scary feeling is coming deep, deep inside the childhood experience. He never dealt with it as a child. So what we did with psychotherapy is try to teach Tom how to erase this memory and give him medication to decrease the rumination. Rumination, the problem with the amygdala is always you remember the amygdala is always want to keep you safe and alive. So the way I do it is always reminded you of the past so you don't do it again. So the amygdala always put in his mind that you might be poor again, you might be on the street again. So this is what caused him to have all of this anxiety. Now, Tom will not tell us this information quickly, like we said yesterday. This is deep in his unconscious mind, deep in his limbic system. So it took like 6 or 7 sessions before he revealed all of this information to us. So you need to build a trust with Tom and deal with him and go deep in his unconscious mind and try to gain what's going on in this unconscious mind where he had all of this memory that really scaring him. Now, what is the long term? If we don't treat anxiety in the long term, we have increase in these stress hormone. And we said these stress hormone, cortisol, norepinephrine, are not good to have for a long time. They are meant to increase for a short period of time to protect you, to run out from that lion. But when that lion is gone, you should turn them down. But most people cannot do that. So you see patients with anxiety having this increase in cortisol level. You see their face is like the moon face. They have big tummy because all of this cortisol that accumulate in them. So you see them stressed out in their 20s and their 40s and 50s. They have diabetes and heart attack and high blood pressure. Why? Because these locus staphylococcus, which usually acutely activated during stress, keep pumping this norepinephrine for a long time. And when you have this high norepinephrine, high blood sugar, it puts you at risk of having sudden death, atherosclerosis, and MI. And this is what happened to most of these people. Also, they increase your immune system by triggering this white count. And the trigger of white count put you at risk of autoimmune disease. So these patients who are very anxious at risk of developing a lot of autoimmune disease like arthritis and MS and a lot of illness that related to the autoimmune disease. Because remember, when you are faced with a stress, you need to increase the white count to fight that germ or virus or stress. So if there is no germ or virus, this white count or this white cells try to attack you instead. And this is one of the explanations of the autoimmune disease. But having increase in norepinephrine or noradrenaline and cortisol for a long time cause platelet aggregation and cause the hardening of the arteries. So you see most of physicians, most of the out of heart disease, and most of my friends take up in the artery and cause the artery to harden because of that increase in norepinephrine. So remember, increased norepinephrine cause platelet activation and increase cytokine and interleukin and cause hardening of the arteries. Now, one thing might happen is we said that when we are anxious, we activate the sympathetic tone, the norepinephrine and cortisol. But for some reason, some people might activate the parasympathetic. Remember, when we activate the fight or flight response, we increase norepinephrine, cortisol level, and we put ourselves at risk of diabetes, hypertension, and heart disease. But when we activate the parasympathetic tone, we kind of like give up. So one of the defense mechanisms, you see patients just relax and sit near the wall and like, I don't want to do anything. And we inherited that from our ancestor. So this is my grandfather on the ground, and the bear here were able to catch him. So here he did not activate the sympathetic tone. No, he activated the parasympathetic tone. So he relaxed and he pretend that he is dead. So if you pretend that you are dead, the bear will not eat you. So this is why one of the trick. So pretending that you are dead, then the bear might not eat you and you will survive. So this is what we learn from ancestors, where sometimes in the face of stress, we freeze. Instead of either running or fighting, we just have a freeze. Freeze means you just activate the sympathetic tone, the parasympathetic tone, and you just want to sit and so if he eat you, at least you will taste very delicious. Or you will just freeze and just do anything and just relax. In summary, then, don't criticize anyone. Also, don't say ya khala or old lady to any female. Always blame the chicken. And if you are going to be eaten by the bear, please try to taste delicious. Let's move to the next talk, which is panic attack. Look at panic attack as a, exactly like anxiety, but a more severe anxiety. So panic attack usually happens suddenly. So you are sitting in your chair and you have a sudden increase in that norepinephrine, where your heart is pounding, sweating, tremulous, air hunger, smothering, chest pain. You are about to die. And this is very, very common in our society. So there is in my clinic, at least I have 60 or 70 patients with panic attack on an ongoing basis. So it's very common and usually suddenly happen and suddenly subside, last for 10 minutes. But this 10 minutes is very, very, very traumatic and very bad. So you will never forget panic attack when you have one. It's exactly when you are chased by a lion. So what happened in the panic attack is exactly like a lion chasing you, and your amygdala is activating your HP axis to the amount that is way above normal, that you are hitting the brain with thousands and thousands of norepinephrine to the point where you are suffocating and unable to breathe. So it's exactly like the fight or flight again. Running for your life and dumping all of these chemical in your brain to survive. So this is what happened in panic attack. The panic attack, very frightening, and there will be secretion of a huge amount of norepinephrine or noradrenaline. Noradrenaline and norepinephrine are the same in your blood level, in your bloodstream, so you can survive that attack. So the secretion of the norepinephrine and cortisol usually happen from the adrenal glands. So the locus coeruleus secrete norepinephrine and the adrenal cords secrete norepinephrine. So norepinephrine is secreted from two places, the locus coeruleus in the brain and the adrenal gland in the abdomen. So this is two places where we get norepinephrine from. And we get too much of norepinephrine with it. So locus coeruleus usually secrete norepinephrine, like we said, is like this. So to keep us alive, to make us function, it make it like a pulse, every few seconds. At nighttime, of course, it will be a lot less so we can go to sleep. In panic attack, it will be like this. So it secretes huge amount of norepinephrine. So here where higher and great are in the middle. Now when we have exam, we might shift a little bit to the increase, or when we sleep and go down, we shift a little bit to the low. So if we don't have any norepinephrine, then we are slow, we cannot think. We call us having attention deficit disorder, ADHD, where we are slow, we cannot think, we just stay sleepy and tired. On the other extreme, when we have panic and anxiety attacks. So all of our norepinephrine secretion should be in the middle here. In panic attack, it's usually, as we said, a huge amount of norepinephrine. Now, it's understandable when you are chased by a lion to have all of these norepinephrine. But most of the panic attack happen for no reason. So sometimes our frontal lobe imagine something in the future. That imagination can act like a lion chasing us. And this is why we said we pay a heavy price for having a frontal lobe. That frontal lobe that God gave us to imagine things and make invention, we are using it to imagine danger and making our life miserable. And as we said, when we have this panic attack, there is a huge amount of ACTH causing cortisol level, norepinephrine, and noradrenaline to be secreted in very, very high amount. The patient will feel sweaty. We feel like I'm about to die. I cannot breathe. My heart is pounding, and it's really very severe. So usually it happens suddenly. The patient might have a blurry vision, dry mouth, feel like he's choking, tingling, muscle pain, hot flashes, cold flashes, cramming, a lot of pain in the back and in the stomach. And it happens suddenly, and then it subsides suddenly. So panic disorder is having panic attacks. So when you have several panic attacks, we call that panic disorder. So we have panic attack 1 or 2 times a week. That's if you keep having those for a long period of time, then you have panic attack. You have panic disorder. So panic disorder is having a lot of panic attacks every week. For example, but panic can happen not only because of the unknown reason. Sometimes if you drink alcohol or use drugs and you stop using these drugs and alcohol, you might go to panic attack. So we don't call those panic attack, we call that withdrawal symptom from the alcohol. Like if there is an alcoholic who stops using alcohol suddenly, then he will have panic attack. But this is not panic attack. This is panic symptoms related to withdrawal from alcohol or marijuana or whatever. Like panic disorder, like anxiety is more common in women, and most panic attack in women are caused by men. I'm just kidding here. So what is the risk of having panic attack? Is like we said here, age 15 to 24 and age 45 to 55. This is the 2 years in our life where we have a transition from childhood to adulthood and from adulthood to geriatric. So this is the 2 period of time where we have a lot of panic attack. Being divorced put you at more risk of having panic attack. Limited education, physical or sexual abuse in the children. A lot of uncertainty can put you in panic attack. Remember, uncertainty is a huge problem for all of us. Also, most patients with panic attack, they have certain characteristics. Like if you look at the childhood, they were fearful, nervous, shy as a children. Like Naina, they have very low self-esteem, most of them. They are, subjected to family problem as a child, or they have very controlling or critical parents. They are passive. They don't like to do things. They like to go with the flow and not invent anything. They usually trapped. So like Dr. Z, he was trapped in a marriage. So when you are trapped in a marriage or in a job, you are more likely to have panic attack. When you have many problems, unhappy job, if you are not assertive. So most patients who are not assertive, they are subject to panic attack. So always one of the things we teach our patient how to be assertive, like to say no when you have to say no. Don't sugarcoat anything, just try to be frank and clear. And the most common reason of panic attack is really, I see in my office, is being trapped, whether it's a marriage or a job or whatever. Sometimes it's intense desire to succeed, like if your family sent you to do something that you don't like and you cannot have the ability to do it, then that will put you at risk of panic attack, where you have a lot of pressure to do something, but you don't have the ability to do it. So when you do that, then you will have, the panic attack, because your brain will be hijacked by the emotion, and that causes severe panic attack. Let's take the case of Kumar. Kumar is a case who came to me a couple of years ago. Kumar is a 52 years old man. He is a doctor in our hospital. This has happened 10 years ago, so Kumar is not here. I name him Kumar just because he's of Indian origin. So his real name, we cannot say his real name. Let's name him Kumar. So Kumar is an Indian doctor who works in our clinic, in our hospital. He's a very good doctor, and he was 52. He came suddenly to my clinic. He said, Dr. Ali, I was driving on Khreis Road between Khreis and, Khreis Road and Dabab Street in this area where I drive every time. I have this panic attack on the traffic light. So, it happened twice. Sudden, unexpected. He was driving, stopping on the traffic light. And when he stopped on the traffic light, his heart started pumping, and he felt dizzy and weak, tingling numbness in the hand and finger, felt impending doom that he's about to die. The typical symptom of panic attack. So all of this, we said, is an increase in the norepinephrine level, and this is typical of panic attack. But before we do anything, we get a cardiology workup, because at age 52, there is a chance that it could be heart attack. So always before you treat any panic attack, especially when the patient is in his 50s and 60s, you always rule out heart attack, and then you start him. So he was a doctor, he was cleared, and they said he had panic attack. But the question he had here is, with Kumar, is as a doctor, we said we are like a detective. We want to see why this happened at the traffic light, why it didn't happen like in the mall or in anywhere else. What is the meaning of the traffic light? This is what we're going to tackle in the psychodynamic education here. So we look first at the free-floating anxiety. So we ask Kumar, what's going on in your life? Tell me what's going on. How is your life, and what's going on there? So he told us that he is worried about his parents in India. They are in India. He lives here alone, and he want to go back to be with his parents, but he is living in Riyadh to make some money and go back to India. And his plan is to go back to India at any time. So he was postponing that, going back just to get a little bit more money, because he will not be able to make the same money in India that he is making here. But he was a little bit concerned about the health of his parents, who are in their 80s, and the children and the career and all of that. So what happened with Kumar is when he was driving, apparently, when you have this free-floating anxiety, it always comes to your mind, even when you are driving your car, or when you are, laying on bed, or when you are sitting alone in your office. So this feeling always bombarded you all the time. But when he was driving on, and stop in the traffic light where he doesn't look at the road, he immediately start having this norepinephrine causing panic attack. So in psychotherapy here, in psychodynamic psychotherapy, why Kumar react to the traffic light like we react to the lion? This is the issue, is it happened twice on the traffic light. So apparently the traffic light has some meaning in his unconscious mind, because in psychiatry, there is nothing happen arbitrarily. Nothing happened without a reason. We always have to see what is the relation between this and this. So Kumar, we said he had a lot of feeling about anger, resentment, childhood, feeling of guilt about being alone without his parents, not taking care of them. So all of this feeling, usually he blocked them from coming to the DLBFC. We said yesterday that the lateral prefrontal cortex is the thinking part of the brain. So this is what make us as a physician and as a medical student, what make you who you are and pass all of this exam, because you have very good DLBFC where you have working memory, and you don't want anything to go there because you want to keep it intact so you can pass exam and deal with life stress. You don't want any feeling to come there. So we use something we call repression. Repression is when you repress something from coming to the conscious level so you can live normally. So Kumar was able to do that. So he used a defense mechanism called repression to prevent those feelings about guilt from being here, not being with his money, with his family, his parent, and all of the ability to live here without his family. All of that was able to be blocked by him because he is a physician and he needs his DLBFC to be really in good shape so he can handle the stress of seeing patients. So the issue here is the conflict. We said in any panic or anxiety attack, we need to look at the triangle of conflict between the id and the superego. So the triangle of conflict here is the id wants the money. The money is very good. He wants the money because he lacked money and he want to establish life. But the superego is trying to curse him for being here, leaving his parents in their 80s alone, and it's time to go back to India. Enough of the money, go back to India and be with your parents. That struggle between the id and the superego was helped by the ego, where he did something we call repression. Repression is where you push all of these feelings down so they will not affect you and cause you to have horrible feeling during the day. So that is the ego who do that, and that's the ego who helped him survive all of these years living with this guilt and this feeling of having of the money. So repression had helped Kumar after this feeling of feeling guilty of not being around his family, and he used this defense mechanism to maneuver between his desire for the money and his guilt feeling about being with his parents. So here is the struggle. The real struggle is Kumar at age 52, and he is in Riyadh. I think, at 52, you should not be in Riyadh. You should be back in India. I think at 52, or at any age, you should not be in Riyadh. I'm just kidding. So at 52, at least, you should be back in India to reestablish your life, to be with your parents. But the money was too important for him. And this struggle between the id and the superego and all of that is what caused this anxiety in Kumar and caused him. So what happened is here is, what is the meaning of the traffic light? So the traffic light here, why the panic happened at the traffic light? Because when we look what we store in our unconscious mind, the traffic light is the meaning of the traffic light is waiting. And Kumar has been waiting for a long time. Every year he said, I'll go next year. Every year I go next year. So the amygdala is really not happy with him making all of this decision. But when the traffic light comes, the traffic light's symbol of waiting. The traffic light, especially this traffic light on Kharis Road, sometimes you stop on it 3-4 times. So you have plenty of time to have panic attack there, reminding you of the waiting you have been doing for the last couple of years. So seeing the traffic light could have, what we call it, trigger those emotion, which he was able to keep and push deep inside his unconscious mind and cause him severe guilt and severe panic attack that, wow, I should have been last year. What's going to happen if my parent die? Attack. So the symbol of the traffic light is the waiting and the decision that he was, he told us that he was planning to go for 5 years ago and he kept postponing it for one more year just to get a little bit more money. So the fear of when you have a panic attack is you have a fear of having another panic attack. So most of the patients who have panic attack about thinking about having the other panic attack. So you have panic attack and then you have fear of another one and then you have another one and you have a fear another one. So the worst situation about panic attack is that you have intense fear about having another panic attack. So this is where we need to work in psychotherapy with Kumar and resolve, not just giving him a medication to treat panic attack, but also giving him a psychotherapy to teach him how to, deal with these issues about his future, how to handle the future, how to deal with the making decision. You don't tell Kumar, go back to India. No, you just give him the option. What is the meaning of your parent? What is the meaning of the money? How important the money for you? How important? Give me a score, how much your parent means to you. Give me a score, how much the money means to you. And let him make the decision. Don't make the decision for Kumar. Let him make the decision. Now, adding to Kumar's problem is really uncertainty because he was not sure about if he go back to India, he's going to find a job, how he's going to survive financially, how long he's going to be staying here, what is the social situation in India if he goes there. So this uncertainty, we said, Uncertainty, we said, is an ugly thing. It's not good for the amygdala. Amygdala doesn't like uncertainty, so uncertainty make you use the limbic system. We said we need to teach patient how to use the frontal lobe, our rational brain, our new brain that God gave us to think normally and logically. When we have panic attack, we tend to go back and use the limbic system, the old brain, the irrational brain, the panic attack brain. So really, that what caused Kumar to have anxiety and panic. Uncertainty made him go and use his unconscious, primitive limbic brain, which is not a good brain to use in all of these situations. Let's move now to a specific phobia. And a specific phobia is like when you have a fear of snake, fear of being on an airplane, fear of going to Burj Khalifa and being on the top of Burj Khalifa. All of that is called specific phobia. So it's phobia directed to one thing, and it's lasts like for a period of time, like 6 months, and it's directly related to situation. Like I will let you read the DSM-5 criteria. I'm not going to go through it, but let's give you an example of that, and we'll use another Pakistani guy here called Dr. Sabri. Of course, his real name is Dr. Hussein, but we'll name him Dr. Sabri just for confidentiality. I'm just kidding here. So Dr. Sabri is a 40-year-old physician who had, he was going for a meeting in Europe. So he's a Pakistani guy who lives in Riyadh, and apparently he is going to some conference paid by some companies to go have fun and a couple of meeting and scientific seminar in Paris. So it was like a fun and teaching flight. And he is very happy to go at that time. And apparently, he lives alone here. His wife is in Pakistan or India. And he lives alone, and he goes back and forth to Pakistan every couple of months when he can. So he told me that he went to the airplane, and in the airplane, when he got to the airplane, he started having severe panic attack where they have to escort him out of the airplane because he was vomiting and having similar to a heart attack. So he said, I was deadly afraid of flying. Even the thought of getting on the airplane was causing me to have impending doom as I was about to die. He felt, sweating, and his palm became sweated and had upset stomach, and he was very terrified, extremely terrified. So he was almost incapacitated, and they have to escort him out of the airplane, and they did not fly to Paris. He came directly to my clinic, and so here we need to see, is it really a flight phobia or not? I don't think it's a flight phobia because Dr. Sabri used to fly all the time. So flight phobia doesn't happen all of a sudden. It happens every time. So apparently we need to look at the unconscious conflict. As a psychiatrist, you need to look at really what is the conflict is going in the unconscious mind that caused this symptom. You just don't treat him as a specific phobia. Where is this fear coming from? Dr. Sabri has been on an airplane many, many times without any problem. Why this time he is having this? So we figured it out after we have several sessions with him. We need to know where is the conflict here, deep in the unconscious mind. What is the unconscious mind doing to Dr. Sabri? Why is causing him to have this panic attack? What is the process of struggle? What is the conflict that is deep causing him to have this unconscious feeling? So here we go. We put our theory again. So Dr. Sabri is going to Paris. He's going to have fun. Is getting out of Riyadh, getting to Paris, listening to some, learning something, getting CME, and having fun for 3-4 days, paid by the drug company. So it's a free trip to enjoy and all of that. At the same time, the ed like that. The ed is very happy about it, going out and having this fun. The superego said, this is what his wife was playing with him, is you are leaving me alone here with the kids. I'm suffering here in Pakistan in a very difficult situation with the kids, and you are going to Paris to play and have fun, and I'm miserable here with the kids. This is not fair. So his unconscious mind did not like that. He, always when we have a struggle, our unconscious mind cook a conspiracy. How I can ruin your life. Our unconscious mind is our biggest enemy. His unconscious mind said, okay, Sabri, I'm going to show you how to have fun now. Why you are leaving your, he show him the guilt about having fun in Paris while his wife is with the kids. So let's play it on you. And he has social, or what do you call it, the flight of phobia, phobia of flight, to prevent him from going to that having fun. So here, our brain is our enemy. Our unconscious mind is always our enemy. It's the one that really causes us to have all of this feeling that I'm not going to let you have fun. So always listen to your unconscious mind and see, sometimes it might play a trick on you and make you really guilty about going to have fun. And so this is not a flight phobia. This is a what you call it, a unconscious mind is taking a revenge from you for doing this a trip while leaving your wife, raising kids in India or in Pakistan in this miserable situation, and you are having fun here. So this is, some people might call it, phobia of a flight. I call it phobia of wife, or phobia of having fun while your wife is miserable, So deep in the unconscious mind is the struggle here. The area of struggle is really the vacation fun versus the guilt about leaving my wife alone in Pakistan alone, and I'm going to have fun. So this is where the struggle here, and this is what caused him to have a lot of panic and anxiety attack. Do you think we should continue, because we still have about 10 minutes, so we're gonna make all of this part later on. Do we have time to continue, or we need me to stop and have answer some question? Hello? Hello?
Yes, doctor, we can hear you.
Yes, do you need to continue, or do we have time to continue, or wait for, or have some questions?
We still have 6 minutes left.
Okay, so I'll continue. The next subject we're going to talk about is social anxiety disorder, or SAD. SAD is very common illness, especially in Saudi Arabia. It's one of the most common illness we see in the clinic. Is the third most common psychiatric illness. Is called, some people call social phobia, some people call it social anxiety disorder. It's the same, so you hear this word. It's very common. It's these patients are miserable patients. They like to stay home. They have great time during Corona because they were forced to stay home anyway. They always, like to work night shift because they don't want to be with people. So always like to work night shift. It's equally in men and women. I think it's a little bit more common in men. Mean age of onset between 13 and 20. Start late in adolescence. Usually, they have very low self-esteem. They are shy. They have very poor eye contact. They have fear of negative evaluation. Put a big mark on this. What is the main problem with social phobia is fear of negative evaluation. They are very scared of people, comment on them, or they cannot tolerate any negative comment. So they like to stay out of people because people might criticize them. So people, who are social, they tend to have a lot of dopamine. Dopamine is the neurotransmitter that make us socialize and be happy and take risk and have friends. These people probably have low level of dopamine, so that they don't like to be socialized. And they are fear of criticism, so they are fear of negative evaluation. Also they have the most common manifestation of that is fear of public speaking. They have a lot of fear of public speaking. Public speaking fear is number one fear in America. Remember, death is number 7. So this is number one. So it's really very common and very traumatic. So it manifests by those patients who doesn't like to do it. Like I have a lot of friend doctors who are very good doctors, but they are scared of doing any presentation. They get, public speaking phobia. It's very common with those patients. As we said, it's very, very common. It's the third most common psychiatric illness. And usually they are very shy, and usually they fear of being judged by others, so they always like to be isolated. They don't like to be around people. They will never invite you for lunch. They will eat secretly. They even when they go to work, they do night shift. They have fear of interaction. So when they are in such a situation, they happen to them what happened to Dr. Sabri here is exactly what happened in specific phobia. So when they be around people or in social crowd, they feel like they have panic attacks. So they have panic attack when they get into a social situation where it's stimulating for them. They become the same way they react same way to the lion that they react to the people. The same way they react to in social phobia. So the main issues with the social phobia is fear of negative evaluation. What is the root of social phobia? The root of social phobia is, if we go to the root of social phobia, remember we said last time that if you have a cold mother, now not everybody who had cold mother is going to have social phobia, and not everybody who had social phobia had a cold mother. No, it just increases your odds to have social phobia. It's like we said, when you smoke, you increase your odds of having lung cancer, but you can have lung cancer even if you don't smoke, and you can smoke and not have lung cancer. So this is what increases the odds of having social phobia is if you have an emotionally cold mother. That's why you always have to take care of your wife so you don't have your kids to have social phobia. Also, if you have a critical father, your father father and mother is the first object relation. So this is the first two people you meet in your life. If they are critical of you, or if they are not interactive with you, then you're going to grow up to be very, very isolated, and it spill over all of your relation. It's the foundation. Your parents are your foundation. They know you better. Like an example of that, there is a guy, Palestinian guy, he's a friend of mine, and he's a professor at Yale at that time. And during that time, he was 70 years old, and they gave him a huge prize. One of the, it's almost like a Nobel Prize for one of his discoveries. So we asked him, you must be very, very proud to have this. Nobody else have this, recognition but you. And he told me, Dr. Ali, I feel like a butterfly. I feel like an ant. I feel like an insect. He said, why? He said, because I have very bad childhood. He said, what's going on? All of this, all of this celebration, all of this prize doesn't mean anything for him. Why? Because he told me when I was young, a child, I was in Palestine, and he asked me to tell you all this story, but I will not tell you his name. He said, when I was young in Palestine, my father told me one time that الفرق بينك وبين الحمار إنه أذنيك أصغر شوي من أذنين الحمار. I will translate it that the difference between you and the donkey is that the donkey's ear is a little bit longer than your ears. So that stuck in his mind, and it never left him. So that's why when the parents say something to the kids, it will stick in his mind forever. So always we have to be very, very careful telling our kids anything bad, because parents knows better. If your parents said you are this, it will be with you for the rest of your life. So always tell your kids that you are the best thing, you are smart, because once you tell them something, it will be part of their gene, it will be part of their brain, it will be part of their makeup. So this guy had severe social phobia despite all of this, because one word came from his father about that he was almost like a donkey. So that's why we really need to be careful in this, because the childhood is our foundation. Our foundation, when you get 5 years old, your brain is almost done. It's almost built. The everything after that is just cosmetic. So that's why a psychoanalyst, when they raise their kids at the age 6, they will celebrate that they graduate and their brain has completely finished. Now I will leave you with this before I finish. This will be my last slide. No, this is my last slide. Where is the gene for social phobia? This is a human. The gene for social phobia or shyness, the gene for shyness was hiding behind other gene. So this is just a joke, not the science. So this is a final slide. Final slide is telling us that we as a physician, we as people who had very high achievement in medicine and in science, usually we had very bad ability to deal with our children. Why? Because we spend all of our time reading textbook and taking care of our cortex, the thinking part of our brain. We never had time to look at our limbic system and deal with our emotion because we were so busy. So most of our time spent behind book and textbook and doing lectures. We forget about how to handle life stress, socialize with people. So we grow up to be very tough and very dry with our kids and dry with our family. So we really need to be careful. As an advice for you as a medical student, try to balance your life between reading and keep your social life, keep your social activities intact. Thank you very much, and I'll see you on Sunday, inshallah. If you have any question, please let me know.